There's not that much research that's been done in self-management in people with catheters, so you are going to be hearing about this study, and I'm delighted to tell you about it today. This is an objective that I have for the presentation. And this is the theoretical model that I use. I was really focusing on self-monitoring as a component of self-management. As you can see, these are listed. Awareness and self-monitoring, we believe, are iterative, and those processes together help people to understand more about what's needed in terms of self-management behaviors. We also believe there's a feedback loop to self-efficacy, so that when people are successful in their self-management, it increases their confidence. And these are the outcomes that we looked at. The intervention included 4 contacts with the intervention nurse, 2 home visits in the first month to teach self-monitoring and to review the educational booklet in detail. We asked them to keep a 3-day urinary diary. There was a booster home visit of 4 months and a telephone call 2 weeks after the intervention visits in the first month. The purpose, again, was to increase awareness, self-monitoring, and self-management behavior. Data were collected through bi-monthly phone call interviews for a year. We had a 74% completion rate at 12 months from the 202 people who were in the study. Attrition was similar in both arms. The sample was very diverse in terms of age, race, ethnicity, and diagnostic background, and about a little over half had an indwelling catheter as compared with the suprapubic. This is a picture of the catheter calendar that we use to increase our accuracy of recall every 2 months during the phone call interviews. And you can see there's a simple code here for the problems, and they were to write it on the dates, and then the treatments. This is the basic component of what we were teaching in the educational booklet. It's the first page of the intervention booklet. What we found out in previous research is that people very often didn't know how much fluid to consume, and sometimes they were taking 4 to 8 liters of fluids a day and not realizing that was too much. So we taught them to be more aware of what their fluid requirements were, to maintain fluids at an optimal and consistent level throughout the day. And we estimated this as 30 milliliters per kilogram of body weight, which is what the US WOCN group has suggested. We also suggested they pay attention to the color of urine all day long as a quick barometer of their fluid capacity. The other major part of the intervention was to prevent traction and accidental dislodgement to prevent damage to the urinary meatus, or UTI. Also, we believe preventing kinks and twists could help to prevent bladder overdistension and also decrease UTI. This is our guide to problems and action strategies. We taught everyone to pay attention to fluids and to prevent dislodgement of the catheter, but the study nurse also addressed, there were trained study nurses, there were 2, 1 for each site. They addressed other strategies based on the patient's needs and interests. The longitudinal GEE analysis for repeated measures indicated that there were no significant group differences in the 12 months of the study for UTI. However, the downward slope of the graph lines indicates that there were some improvements which were sustained over time. The red line is the intervention group. However, the rates between groups and within groups from baseline were more informative. The intervention group UTI rate went from 6.9 to 4.9, and in the control group went from 5.5 to 4.1. These are significant drops. The UTI rates were significantly lower in the control group in the second 6 months, but you can see that comparing at baseline, the intervention group had significant differences from their beginning, and it was sustained over time. And the control group had this during the second 6 months. The blockage graph depicts the significant group differences which were found in the intervention group during the first 6 months of the study. We do believe this is an important finding, and we believe that the fluid component of the intervention might have contributed to this result. However, we cannot know for sure because both groups improved over time for blockage. Look at these significant results here. And you can see that the significant result for the intervention group was sustained from the 6 months through the entire 12 months. Because there were not consistent group effects, we decided to collapse the entire group and to test our model and use structural equation modeling. And we had a measure that we developed and it's been published in urodynamics, uroneurology and urodynamics. We looked at this time just at the fluid component, and we found out that structurally, fluid self-efficacy, I know you probably can't see this too well, but it's in the article which was published in Nursing Research in March. Fluid self-efficacy was positively associated with fluid self-management. Fluid self-management was not associated with either the presence or absence of CAUTI or the rate of CAUTI. Fluids self-management predicted less blockage, but not whether or not blockage occurred. The conclusion is that blockage improved only in the first 6 months of the intervention group. However, both groups improved with decreased urinary tract infection and blockage over 12 months compared with baselines. We also believe that the catheter calendar and bi-monthly interviews were a possible unintentional self-monitoring intervention, and we have an article that's being developed about this, comparing the groups with their final question at the end of the study. The SEM suggests increased confidence, self-efficacy, which Kara talked about before, about fluids can increase self-management about fluids, and possibly decrease the frequency of catheter blockage. And these are research teams from the University of Rochester, visiting their service in New York, and we had some additional researchers for the SEM analysis. Thank you.